When the first total knee replacement fails, what you should do? Now, the most important thing we should understand is we want to prevent a failure of the first knee replacement. We want to have the patients to have the best knee replacement which will last about 25 years. We want to use the patient the best technology available. Like we do here, robotic knee replacement, we have a Pixie augmented reality replacement, which actually reduce the risk of failure. Because of that, our results are about 25 years. All this is very subjective. Now, suppose all this happens and the knee replacement starts failing. How do you know it's failing? The first symptom of failing knee replacement is a reappearance of pain. What you didn't have for many years, 20 years or 25 years, which starts again. Pain on walking, pain on moving, pain on doing your day-to-day activity are suggestive of a failing knee replacement. Then what you should do? Then you should immediately approach the orthopedic surgeon where we do the analyze. What's the reason for pain? Then we see normal x-rays. Sometimes x-rays are not helpful in diagnosing the loosening of the knee or failing knee. Then in that case we do bone scans, PET CT scan to diagnose where the failure, and we also do some blood tests to know why the knee is failing. Now here we broadly divide the failing knee replacement into two categories. One is a aseptic loosening, means loosening happened over a year, didn't happen because of infection. And so second group is called septic loosening, where the reason is infection. Septic loosening can occur at two stages. One, it can happen immediately within the first 3 weeks to 6 weeks after surgery. It can happen anytime. The anytime septic loosening, common cause is urinary tract infection or other infections coming from other areas. Now, once we diagnose, then we do a thorough planning of how do we revise this. So revision of knee replacements are categorized into single stage revisions or two stage revisions. We do single stage revisions when there is absolutely no evidence of infection in the knee, either by the blood test, bone scan. If there's no evidence, then we do a single stage, remove the component and use a different components for a revision. Suppose there is septic loosening, we don't do single stage. Single stage has a high risk of reinfection, close to more than 10-20%, which you should not. So first stage we go, remove all the infection, send in for testing, leave the patient, put a spacer in the knee joint, wait for 6 weeks, give 6 weeks of IV antibiotics, and then go for the second stage. If you follow the strict criteria of proper planning and execute, then the reinfection rate will come down to, naturally it's not less than 1%, it will be about 3 to 4%. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.